Hi, everyone. My name is Mike Sutton. I'm the Chief Technology Officer at Innovaccer. We're going to spend the next 15 to 20 minutes talking about how Innovaccer has taken some innovative approach with our customers, and in particular, one about building healthier communities of the future. What I'm going to talk about is who is Innovaccer, first off. What's the industry challenge in the healthcare and life sciences space we're addressing? Some of the solutions we've created, I'm going to do an overview of those. And then I promise I'm going to go into some detail. I have 3 detailed slides on the reference architecture about the solutions we've created and how we're using the Amazon platform, to build out these solutions and capabilities. One of our customers has given me permission to talk about what they're doing with us and how they're solving and improving health in the community that they serve. And then finally, the benefits of partnering with AWS and why we've been using the Amazon platform for really over 6 years in helping people deliver care within the United States. So first off, Innovaccer. Innovaccer, I'll first tell you how to pronounce it. It's a combination of the word innovation and acceleration. So it's Innovaccer. Started about 6 years ago. The founder still manages the company. And what we are is a clinical data integration company. We've built a practice with over 600 engineers of bringing in data from the electronic medical record systems that really the healthcare industry has spent the last decade in building out. And we've had the opportunity to integrate data from over 80 EMRs. I'm not sure I can name all 80, but we do have a list if you want to double check it. We've also built out integration with many of the major national claims systems. So we can bring in the claims data, we can bring in the clinical data, and as you're going to see in some of the subsequent slides, how we bring in community data, social determinants of health, remote patient monitoring type data, with the goal of bringing in a unified patient record around those members and those patients. We've done this at over 1,000 locations, and we've been very fortunate that our customers have rated us very high this last year in both Black Book and KLAS, being number 1 in the category for our data activation platform with Black Book, and then of the population health tools that we build on top of our platform in the KLAS ratings. A little bit of statistics on the right-hand side. We have about 24 million lives that we manage the data for our customers, over 50 healthcare organizations. And then probably most importantly, we're serving and helping provide insights to 37,000 providers. And the plus signs are after that because it's growing every day as we get more and more people working on our system. So let's first go a little bit of why data integration is so complex and how we got in the place in the healthcare industry that we are. So here's the challenges that we're solving. Like I mentioned, we've spent a decade building out the EMRs. And they're doing a fabulous job of recording the encounters, the transactions, the well-being and caring for this membership. And what it's done, you can see the number of there, 2,314 exabytes of data, which that's a zettabyte for those of you keeping track of the numbering system that we have. But that's a lot of information that has been created by these transactions and these clinical systems and claim systems that we've been trying to manage over the past decade as these have been rolling out. And there's a lot of people in the market doing this. There are over 49,000 healthcare apps that have progressed. There's 3,000 healthcare startups. And there's been a lot of money in this particular space of taking this transactional data and creating insights and analytics, and most importantly, helping to influence decisions and behavior at the point of care. So despite all this information and all these people trying at it, we are still fundamentally disconnected. There have been some great strides made, with the implementation of the FHIR APIs to help organize and coordinate these. But the fact is, there are many, many different standards that have progressed in the industry. And as in my prior roles, being an IT operator in this particular space, is you must integrate these in order to create a seamless care for your patient, which she's pictured there in the middle. So the Innovaccer point of view of this is we believe that we need a platform that can help bring this data together, because it's not going to be overnight that everybody converts to a single standard. And in fact, on the transactional side, there may be very good reasons why different formats need to be used for different for different disciplines. I think most of us know oncology is a very complex, environment. It has a lot of data that's different that we're seeing in many of the EMRs today. So what we believe is kind of a three-stage process. And the first one is we need to get tools so people can innovate. We need to be able to allow, our patients, our members, third-party application developers within organizations to be able to innovate and create great experiences for members and patients. Which means that we have to be able to interop these applications. Not every application, is going to be written by one company or one person. We need to be able to create an ecosystem so these applications can serve our clientele the best. And then secondly is, given that all this data has come available, not necessarily are all the analytics consistent. If you talk to most of the data scientists that I've been working with, is that they spend much of their time looking for the data, curating the data, and trying to get it into a format that they can actually use. And that's not even bringing up the quality aspect of things, where many of this data is not necessarily of the high enough quality or consistent quality to be used in analytics. So we believe, and what Innovaccer has built out on the Amazon platform, is an open, yet extremely secure, HIPAA-compliant environment so we can share the data and protect it. And it has to be radically interoperable. Many of the message standards used today are very batch-oriented, they require work on both ends, in the payer and provider space, and actually creates inefficiencies. And so we believe we need a platform that can help address those inefficiencies in sharing information. So thus, we've created the concept of the Innovaccer Health Cloud, which we're going to help enable customers to build the future of health. Here's we call this the rainbow slide of this picture, but in the center is the patient or the member. And what's most important about that is we are able to collect all of his, or in this case, her information, whether it's in a pharmacy system, a lab system, within an EMR, in a healthcare system, or in a claim system. That data needs to be aggregated. And what we have done is we've created that ability to do that, and I'll show you some of the details in a minute. And we've branded that the Data Activation Platform. And that collects all that information around that particular patient and then makes it available to providers. If you look on the left-hand side, we build a number of intelligent applications to serve things like care management, to provide insights at the point of care. We know physicians are very, very busy, and they don't need to be clicking through, so we provide some very immediate and in-situation type advice on what the next possible steps are. And we provide those applications. And on the right-hand side of that, and equally important, is we provide the capability to work with that data and build your own applications, whether it's for employers to help them their employees navigate their care environment, whether we have some customers that are using it to build out clinical trials and experimentation on that. And then, of course, you can build your own experience. Now that the data is available, that the tax of looking for that information has gone away. So it should make the development of your applications much faster and much more real time, to meet the needs of a consumer environment that's becoming much more demanding when it comes to digital interaction with any of their providers. So as promised, here's the first level of detail of the reference architecture. So it's broken in. You'll see the common theme of the left-hand side is the ingestion piece. Again, I mentioned the EHR type data, but we can also take data from data warehouses that have been built out, because during the past decade there have been multiple attempts to get information out of the EMRs and EHRs in order to make sense of it and provide what we're talking about, that experience with their patients. But same like integrating claims data and then many other data sources. And I'm going to go a little more in detail on that. But we can take them in any format. The idea of waiting for our customers to transform the data and put in a format we could read is a false expectation. So we'll take the format in literally any form, whether it's the modern FHIR specs, whether it's through an HIE, whether it's through batch files on the EMR. or even, and there are still cases where people are doing paper and PDF type files, and we can do that extraction and put in a structured format. That's kind of the data integration and standardization. And then what we do is we create those, we semantically normalize the data and then make it available for activation. And again, I won't repeat that, but on the right-hand side is kind of the customer set that we provide information to. And again, in any of the modern ways, we don't do it through batch jobs, although we can. There are needs. A third bullet down is there's like bulk exports. If someone wants to support something like the OMOP data schema, we can produce those for folks. Or we load the data into other tools that have a healthcare protocol or data structure, and we can load those in there and help that transport. Going one level deeper, this has some of the branding on it. At the top layer, again, those products up there, InNote, InConnect, InCare, and InGraph are products and solutions we provide. InNote, just really briefly, InNote is a point of care solution. InConnect is a way to communicate with customers and patients. InCare is the care management solution we have. And InGraph is the data environment, is what we use to support the business analysts and data scientists, as well as many, many other community applications that are built out. Here's the picture of the platform. There's availability of this directly if you want to go to the detail of the data. So data scientists, as you're all aware, love to get into the details. We have the raw data still available, as well as highly curated data that has been quality inspected and is deemed trustworthy. And then as you go a little bit lower, some of the Amazon services that we're using to implement this. And then at the very, very bottom are the source systems, which is a repeat of the prior slide. And then going to the lowest possible level and turning the orientation, turn it on the side again. Here again, we have the source data. We'll go to some of the details that are part of that ingestion process. You see the AWS Lambda type services on here. I'm not going to go through them all. You can read those. And we transfer that data, and then we get it into the analyze and act environment. Again, with our goal of using native, we deem it native Amazon services, because we want to take advantage of the speed and the dynamic scalability of the services that have been built out on the AWS platform. And then fortunately, one of our customers, Elevate Health, has given me permission to say what they're using our platform for and what some of their breakthrough type healthcare services that they're putting together in the communities that they operate in, which is exactly, if you go to what their mission statement is, they are all about taking advantage of the community services to help provide better healthcare services to the folks that live in their particular region. They manage about 20,000 lives. We have that data in our environment, and we protect and steward that data for them. And what their big part, their major thing was taking files from CMS 834 files for the Medicaid patients and be able to ingest that and then be able to proactively improve and go after the health of those folks in their community. A little bit of the high-level architecture for that, they're calling the accountable communities of health. And as you can see on the left-hand side, they take in the normal data, like from the EMRs. They have health plans that service the area that they take in that data, including the CMS. But they also, in addition, are connected to some of the community resources around housing, criminal justice, and emergency services. All that data is ingested and put together around each individual to provide that unified patient record. And then specifically in this case, they're using 2 of our products and then one of our partners' products. And I'll go to the partner first, is Aunt Bertha, which is a fabulous solution that helps get one of the community services in that area. SDOH is social determinants of health, and I think, as many of us all know, it's a primary indicator and influencer of our healthiness. And so we have created InCare. That's what their care strategists use to develop the strategies around preventing healthcare events, help people with care transition, and help people with disease management. And then InGraph is more of our analytic tool that we provide for the data scientists and the business analysts to help focus on areas and conditions and things that they ought to focus on in their particular community. And the outcomes already in a little bit over a year has really been quite successful. They've reduced the cost of care while increasing the care by $6 million. And this is just in the first year of the implementation of this program. They're expecting almost $30 million per year projection saving over the next 3 years, and specifically around health home protocols of finding people where they are and taking care of them and providing better services so they don't have to come into the hospitals and create an emergency room situation. So I'd like to personally congratulate Elevate Health and really thank them for their leadership, and we've certainly learned a lot from them during this program. And last but certainly not least, I wanted to talk a little bit about how Amazon Web Services makes these capabilities happen in the healthcare space, just like with Elevate Health and our 49 other customers we have using data activation platform. The Amazon Web Services has helped us accelerate delivery into this particular space. And first and foremost is all the services that are available. As mentioned on this slide, there's over 165 services that are available that in cases we used to have to write some of the functions in Python or R or whatever the case may be. Now it comes available on the Amazon Web Services platform, and it's just implementation. And we don't have to worry about the security because it's been built in from the ground up. And we have taken advantage of all those services throughout the cloud environment that we're using. And thirdly, and from a cost-effective standpoint, one of our other customers it went from an on-premise solution with very expensive data management tools, and we helped them move to the AWS cloud. And what they saw was an 81% reduction in their analytic infrastructure costs. And a lot of this has to do with the dynamic scalability, the ability to quiesce services that are not being used, and then just a very effective price point of the Amazon Web Services platform. And then I think we all know it's easy to use and maintain. It wasn't that long ago where we'd have to maintain patching for our environments, we'd have to maintain backups, we have to maintain the failover environments and test those. All of that, as you all know, is well built into the AWS platform. And then last, and definitely not least, is the continued compliance to HIPAA. The HIPAA is not a one-time deal. It is a continuous evolving requirement that we have to keep the most privacy, most security for our patients and memberships. And we can rely on the AWS platform for us to get that. So that concludes my presentation. I want to thank you all for your attention. I want to thank you for your time. And again, my name is Mike Sutton, and it was nice to virtually talk to you all.